welcome in the medical director of Henry Ford Milk Bank Jackson, Dr. Brad Judge. Welcome back to the show.
Yeah, thanks, Bart. Happy to be here.
Yeah, nice to see you again. I saw Dr. Judge at the actual event, the ribbon cutting. He had some very special guests. It was a pretty cool event.
Yeah, it really was. We had some VIPs, Senator Stabenow and the CEO of the health system, Bob Riney, both attended.
And it was a nice, clear day, no smoke then.
Yeah.
But this is the first for Henry Ford, and only the second in the state is Georgia Fatasic, who I think under her direction got the process started.
That's right. Yep. There were some lactation consultants and other representatives from the Women's and Children's Services Division at the hospital who sort of had a dream to bring a milk bank to Jackson, and that was several years ago, at least 5 years ago. So it's been a long process.
Mm-hmm. Yeah, and only I think 30 in the whole country.
Correct. Yep. And we're the second in the state, as you said.
So it's amazing that it is here in Jackson. Henry Ford has obviously multiple locations.
Right.
Jackson, though, was selected. Do you know why this was the plan?
Well, I think it had a lot to do with the leadership at the hospital. I think Wendy Kim, the chief nursing officer, really spearheaded this, and I think she took it to the health system and supported it and championed it, and I think it had a lot to do with the leadership of our local hospital, proving to the big health system that we could do it here in Jackson.
Yeah, and it was neat to hear Debbie Stabenow comment on the state of our healthcare delivery systems here in this community, where she described Jackson as really having leadership in the services and our facilities for healthcare.
Yes. Yeah, we have a unique community here, and we have some significant health disparities, and breast milk feeding helps alleviate some of those disparities. It gets babies off to the best start that they can possibly have, and that was, I think, another important reason why we were chosen.
I think during the pandemic, with the formula shortage, we learned a lot more about the care and feeding of babies.
Yes.
But what is it about breast milk that benefits a baby, in particular, a baby who might be born prematurely or has low birth weight or other health problems?
Right. Well, breast milk is the natural way for babies to be fed. It's more easily digested. It results in better brain growth and development. For premature babies, when you're born prematurely, you're not meant to be eating yet. Your gut isn't fully developed and ready to digest food at all. You're supposed to be getting it through your umbilical cord from your mom. So when you're born early, you want to have the best nutrition that you can possibly have and the gentlest on the intestinal tract. So they're at risk for a type of perforation of their bowel that's really scary and dangerous for premature babies, and breast milk feeding reduces the chances of that. So that's one of the big things, one of the big reasons why we want to use breast milk with premature babies. If moms aren't able to produce milk, then we have the milk bank.
Well, I know one of the questions you get, and I understand why, but I've been on a couple tours.
Yeah.
It's really a high-tech, very professional, state-of-the-art facility, but how do you communicate the safety of donor milk that's provided to infants through the milk bank to moms and dads?
Yeah. We have an information sheet that we share with every parent when they come in, so they can read through that. But just for your viewers, the process is really it's pretty intensive. So the donors are volunteers; they're not paid. They're doing this out of the goodness of their heart. They have no incentive to donate other than that. they go through a screening process that's really similar to blood donation. So there are blood tests that they have that are similar to the blood tests for donation. They have to have a doctor's permission, so their own doctor signs off on their health to be able to donate. And then the milk is tested as well for bacteria, and that's one of the main ways that we make sure the milk is safe. It's also pasteurized.
Yeah.
You probably saw that on your
did.
tour.
It looked like a real dairy.
Yeah.
So I would imagine, I would guess that a mom that is drinking alcohol or using drugs, even prescriptions, would probably not be volunteering to be a donor.
Correct.
But those are tested for too.
They are, yes, and they're screened for. They're questioned, and then their physician also attests to that. And there are medications sometimes that just routine medications that women take or that they have to take temporarily. And there's a long list of medications actually that that can't be given to the baby if the donor is taking it. So sometimes they are deferred for permanently, or sometimes they're deferred temporarily. So their milk isn't used during the time that they're on a specific medication.
I understand that there is a situation where people that maybe their neighbors, family members, they do informal milk sharing.
Right.
What are the dangers for a baby with that kind of a situation?
Yeah, the informal milk sharing is common, and of course, for hundreds of years, women have helped each other out in that way, and so communities of women have helped other babies out that way. But in the modern day and age, we have a better option. And with informal milk sharing, even if it's somebody that you know really well, you don't know everything about that person necessarily. And testing can determine if there are bacteria in the milk. For example, even if you're borrowing milk from your sister and you know everything about her, her milk's not tested for bacteria as it would be at the milk bank. So there are a lot of risks. Obviously, medications. And lifestyle issues that could have an impact on the quality of that milk that you borrow from someone else.
Well, plus transporting the storage. It's like the chain of command. You don't know where it's been.
Correct. Yep. That's another really important thing, and something that is definitely monitored with the donor milk. It's the women pump it and collect it in their home, and it's frozen, and then it's transported frozen to the milk bank, and it stays frozen. It's thawed and then pasteurized and pooled, and then it's frozen again, and it's transported frozen to the hospitals that purchase it.
Yeah, I meant to say chain of custody, not chain of command.
Yeah, yes. Right.
Now, during the pandemic, here's some of that process occurring.
Yes.
Moms, and when it was desperation, there was no formula,
right.
And they were watering down, trying to stretch what they had, or maybe using off-the-shelf milk. So that probably, you don't want to see that happen again.
We certainly don't. There are a lot of health risks associated with those practices, and like you said, people were just desperate. They needed to feed their babies. So
moms, they volunteer.
Yep.
And so their milk it's tested and screened. What else does potential donor? What is the screening process?
It starts with questionnaires, and then, like I said, they have blood testing. So that blood testing is all covered and paid for by the milk bank, so that there's no cost at all to the donor. They have a form filled out by their personal physician attesting to their health, and then they get educated on how to collect and store their milk safely and transport it to the milk bank. If they're local, they can drop it off at the milk bank, and if they're not, we've had potential donors contacting us from the east and west coasts of the state. We've had Port Huron and Grand Rapids, people contacting us when they found out about it, and the milk bank will provide them with coolers and ice packs and the appropriate packaging to ship it to the milk bank.
Yeah, so it's like being a blood donor. People are doing it because out of the generosity.
Correct.
They want to give. They want to.
Yeah.
Yeah.
Yeah. And when you were at the ribbon cutting, so you heard Brittany Ganton speak, one of our first donors, and the women who have been through a birth of a child and attempting to breastfeed know what those first few days are like and how so many stresses that there are. And then they have worries about whether they're producing enough milk for their baby or not. And sometimes things happen, like you have to have a C-section, a major surgery, or there are complications during the delivery. The mom needs a medication that she can't breastfeed while she's taking. And it just is such a huge sense of relief to know that your baby's getting breast milk. And those moms who have been through that really feel motivated to help out other moms in that situation, knowing how it helped them.
Well, and Brad and I are both dads, so we can sympathize with that. We haven't experienced it firsthand, obviously.
Right.
But we know, our wives at that point there, it was very stressful.
Yes.
And I remember there were, challenges. Sometimes it wasn't. It
Yeah.
didn't seem to be working. Is the baby getting anything? And that can be, oh my gosh, huge stress.
Oh my gosh, yeah. My oldest is 29, and she was a bit of a breastfeeding failure. And I share this with my patients all the time. That was some of the biggest stress that I've been through in 29 years with her. She's a pretty good kid otherwise, but she just did not breastfeed. And my wife struggled with supply, and we didn't have this option then. But I know it would have made a huge difference to all of us if we had.
I know that when you started looking for donors that came out of the woodwork.
Yes,
right?
yes. We had more than through the initial process as we were being accredited, we needed between 5 and 10, and we had way more than that volunteered. I did talk to Aaron this morning. We have 12 that have gone through the entire process and been approved, and we have over 30 more without really even advertising. We've had over 30 more who are in different stages of the screening process and testing right now.
Yeah, because you're only able to be a donor within a certain amount of time of giving birth yourself.
Correct, yes.
So if someone wants, maybe hearing about this for the first time, and they'd be interested in being a donor,
Yep.
They can sign up now?
They sure can, yep. The website is up and running, so you can go to henryford.com/milkbank. You can send an email to the staff at milkbank@hfhs.org, or you can call the Milk Bank 517-205-MILK.
Well,
6455.
And as you guys said on the ribbon cutting day, that it may be years before you find out how this impacts the community health. And we've had issues with infant and maternal health.
Yes.
Over the years, but what do you expect to see down the road, how Milk Bank is going to overall improve our community's health?
One of the biggest risks that we're hoping that we can address, and one of the biggest problems that we hope that we can address, is infant mortality. The community has a higher infant mortality rate than the rest of the state and higher than other parts of the country. And breast milk feeding decreases the risk of SIDS. So we've done a huge amount of work in decreasing SIDS overall. Safe sleep is one of the most important things. But when you've taken care of all of that, there still are other risks that can be addressed, and one of those is providing breast milk. So we're hoping that we see decreased rates of infant mortality. That's one of the biggest numbers we hope to move the dial on.
Yeah. So a family hearing that, it's a no-brainer.
Yeah. Yeah.
Well, we appreciate you and your team providing all of this service and information today.
Yeah. Thanks for having me on and let me share that info.
Good to see you.
You too.
Dr. Brad Judge is the medical director for Henry Ford Milk Bank, Jackson.